Hi, I'm Kelly from North Shore Eye Care. Today I'm sitting with Dr. Michelle Liebert, who is a new doctor in our practice. She's a pediatric ophthalmologist. Just want to give her a chance to introduce herself a little bit and ask her a few questions about her job. Hi, how are you? So, I just want to start off by asking you, first of all, why did you decide to become a pediatric ophthalmologist?
Well, not many people know this, but what a pediatric ophthalmologist is a fellowship training that you acquire. It's a year after your residency. I felt like I really didn't know enough about children after my residency, so I just pursued further education, and I just really loved it after that, so I continued.
Okay, good. What are some of the specific conditions that you treat with children, aside from just general eye care? Are there anything specific?
Many of the children come in, parents complain that their children's eyes aren't straight. So they might be crossed, they may wander, and oftentimes I'll observe, other times they may need glasses, or sometimes even surgery. So that's most of what I do.
Where would those surgeries be performed? Are they performed in office, like clinical, hospital?
Right. Well, what I do is I really don't jump to surgery. First I try glasses, prism, all kinds of methods, patching. But if they do need surgery, I operate in the Melville Surgery Center, which is right on Route 110.
Do you remember the first surgery you performed? Anything specific about it? How you felt doing it? Or anything you recall about the patient? What the condition was?
Well, I was very nervous when I first operated. I remember it was a trauma, and they weren't sure if they would ever be able to see again.
And how old was the patient, do you recall?
She was, I think, 6 or 7, and she ended up with very, very good vision, and it was just very rewarding.
Great.
So,
could you explain maybe some of the most challenging parts of your job?
Well, the more challenging are actually the most rewarding. Usually I see a lot of children with developmental disabilities, autism, Down syndrome, and oftentimes they need to come back 1 or 2 or 3 times to get an exam. But when they do, and you treat them and they do well, it's just the greatest feeling.
Okay, so you kind of answered my next question then, because I was going to ask you what the most rewarding part of it. Would you say that is the most rewarding part also?
That's rewarding also, sometimes seeing what the parents' reaction to their treatment, because the children, even if they just get a pair of glasses, they do better developmentally, they're happier children, and it's nice to see.
Awesome. Okay, thank you. So what are some of the offices you're at? I know you're in Smithtown, but what are the other offices so that our viewers know?
Sure. I'm also in Riverhead a few days a week. We found that there was a need there. Riverhead is a nice location because it's in the middle of the 2 forks.
Mm-hmm. So those 2 offices, Riverhead and Smithtown. Okay, great. Thank you so much for taking the time to talk to me.
Sure.
If you would like to schedule an appointment with Dr. Liebert, please call our office at 631-265-8780. We'd be happy to see you in the office, and you can also follow us on our YouTube channel and Facebook. Hope for you to check back soon.